Hello, it is now 2 p.m. Eastern Time. You have joined the 2022 Connect and Protect Law Enforcement Behavioral Health Responses Solicitation webinar. To allow for additional signees past the hour, we will start the webinar in a few minutes. Good afternoon. Thank you for joining today's 2022 Connect and Protect Law Enforcement Behavioral Health Responses Solicitation webinar. Today's webinar is focused on the Connect and Protect Law Enforcement Behavioral Health Solicitation. I'm Demetrius Thomas, Deputy Program Director at the Council of State Government's Justice Center. I will be moderating today's webinar, which is funded by the U.S. Department of Justice Bureau of Justice Assistance, commonly referred to as BJA. To give you an overview of today's webinar, first I will introduce the speakers, then there will be an overview of Bureau of Justice Assistance, BJA, the Council of State Government's Justice Center, and the Justice and Mental Health Collaboration Program. After that, we will discuss the award information, budget, application criteria, followed by the submission requirements. Finally, toward the end of the webinar, we'll have time for question and answers. Anytime during the webinar, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. This includes both technical and content-related questions. We will try to reply to technical questions in the chat window as we go. For the content-related questions, we will keep a running list and address them at the end of the webinar. We will do our best to get through as many questions as possible. If you encounter technical or audio problems during this webinar, please click on the links dropped into the chat box. Please understand that there are some technical issues that we may not be able to resolve. We are recording the webinar and will post it on our website. Now I'm going to introduce the speakers. Maria Fryer is the Justice System and Mental Health Policy Advisor at the Bureau of Justice Assistance, U.S. Department of Justice. She oversees the Justice and Mental Health portfolio and collaborates with the Council of State Government's Justice Center to assist states, local government, and behavioral health organizations to better understand the relationship between the criminal justice system and mental health populations, and to help create policy and programming that meets the needs of municipalities and the citizens they serve. Ms. Fryer previously worked at the North Carolina Governor's Crime Commission, where she advised the governor's office on effectively addressing the needs of victims of violent crime. In addition to working with families overcoming violence and instability in Coffee County, Alabama, Ms. Fryer has worked in community corrections in Fayetteville, North Carolina, hoping to develop intermediate and community-based sanctions for repeat offenders with drug addictions. She also served as the United States Army as a member of the Military Police Corps. Also, we have joining us is Tammy Lovell, who is the State Policy Advisor at the U.S. Department of Justice Bureau of Justice Assistance. Tammy manages the Justice and Mental Health Collaboration Program. Prior to joining BJA, Tammy worked as a law enforcement lead for Maryland State Administering Agency, the Governor's Office of Crime Prevention, Youth, and Victim Services. I am Demetrius Thomas, Deputy Program Director in the Behavioral Health Division at the Council of State Governments Justice Center, and I oversee the Justice and Mental Health Collaboration Program, Training and Technical Assistance. Prior to joining the Justice Center, I worked at the New York City Department of Health and Mental Hygiene, where I led the agency's work at the intersection of criminal justice and mental health and behavioral health, including establishing the city's first ever diversion centers, co-response, and mobile crisis teams. Next, I'll provide overviews of the mission of the Bureau of Justice Assistance, CSG Justice Center, and the JMHCP. BJA's mission is to provide leadership and services in grant administration and criminal justice policy development to support local, state, and tribal justice agent strategies to achieve safer communities. Specifically, BJA provides funding to support law enforcement, combat violence and drug-related crime, and combat victimization. Through the development and implementation of policies, services, and sound grants management, BJA strengthens the nation's criminal justice system and restores security in communities. I'm now going to give you some background on the Council of State Governments Justice Center. The Justice Center is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. This slide describes a bit more about the Justice Center work style and how we strive to reflect core values and includes a commitment to being independent and nonpartisan in every aspect of our work, providing vigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Today's webinar is part of the Justice and Mental Health Collaboration Program, commonly referred to as JMHCP, Training and Technical Assistance, TTA, which many of you may already be familiar with if you currently have or have had a JMHCP TTA grant. The JMHCP TTA promotes innovative cross-systems collaboration and provides grants directly to states, local government, and federally recognized indigenous nations to improve responses for people with mental health illness and substance use disorder who are involved in the criminal justice system. Thank you all for joining today's webinar. I'll be back a little later to moderate the question and answer portion of the webinar. However, I am now going to turn it over to Maria Fryer, who will discuss the award information. Maria?
Thank you so much, Demetrius. And next we'll begin with eligibility. First, I just want to let everybody know that I'm having a little issue with Microsoft Teams, the platform, so I'm going to leave my camera off, but I am here and we're going to begin with eligibility. So let me begin there. The eligible applicants for this grant are city or township governments, county governments, Native American tribal governments, federally recognized by the Secretary of the Interior, state governments, and what we call other. Other refers to public and state-controlled institutions of higher education. Also, it refers to organizations with a different legal status, perhaps nonprofit or for-profit mental health agencies, which can be eligible to apply only if they have been designated as a state agency or a unit of local government to provide mental health services. Documentation to support this designation must be attached to the application. And a mental health agency is defined as an agency of a state or local government or its contracted agency that is responsible for mental health services or co-occurring mental health and substance use services. And for the purposes of this solicitation, state means any state of the United States, the District of Columbia, the Commonwealth of Puerto Rico, the Virgin Islands, Guam, American Samoa, and the Commonwealth of Northern Mariana Islands. I would like to also highlight an important point. Because JMHCP aims to promote cross-system collaboration, we will only consider applications that are jointly administered by a criminal justice or juvenile justice agency and a mental health agency. However, under this solicitation, only one application by any particular applicant will be considered. The other agency or agencies must be proposed as subrecipients or subgrantees. The lead agency must be a city, township, or unit of local government, county government, Native American tribal governments recognized by the Secretary of Interior, public and state-controlled institutions of higher education, state governments will need to be the applicant, and other partners would be the subrecipients under that application. The Connect and Protect Law Enforcement Behavioral Health Response Program is specifically designated to support law enforcement and behavioral health cross-system collaboration to improve public health and safety responses and outcomes that target preliminarily qualified individuals with mental health disorders or co-occurring mental health and substance use disorders. Eligible program participants include preliminarily qualified offenders as defined by the U.S. Code. As it relates to violent offenses, those who have oversight of the program have some authority when determining whether or not a person who has a violent offense can participate in a respective program. Specifically, the statute provides that a person is preliminarily qualified if the offender has been unanimously approved by participation in a program by a list of stakeholders, basically that there's consensus between the prosecuting attorney, the defense attorney, probation or corrections official, the judge, the relevant mental health agency. Provided that those who can make approvals, as I just stated, this list of stakeholders, they determine that the person doesn't pose a risk of violence to any person in the program or the public if selected to participate in the program. In making that determination, the statute requires the following things be considered, and these are factors to be considered whether or not a person who may have a violent offense should be participating in a JMHCP or a Connect and Protect program. In determining whether to designate a defendant as a preliminarily qualified offender, the relevant prosecuting attorney, defense attorney, probation or corrections official, judge, and mental health for substance use agency representative shall take into account whether the participation of the defendant in the program should pose a substantial risk of violence to the community, whether or not the criminal history of the defendant and the nature and severity of the offense for which the defendant is charged, the views of any relevant victims to the offense, the extent to which the defendant would benefit from participation in the program, the extent to which the community would realize cost savings because of the defendant's participation in the program, and whether the defendant satisfies eligibility criteria participation unanimously established by the relevant prosecuting attorney, defense attorney, probation, and correction, judge, and mental health substance use agency representative. So it's definitely a group of stakeholders that need to come together and determine that this person is safe to participate. A person who has been charged with or convicted of any sex offense or any offense related to sexual exploitation of children or murder or assault with the intent to commit murder cannot participate in the program. So now we're on slide 13. This year, the Connect and Protect solicitation is particularly focused on and seeking applications that address one or more of the following objectives. Design and implement a best practice program in crisis response based on present information to assist law enforcement officers during encounters with people who have mental health disorders or co-occurring mental health substance use disorders. Plan and deliver a law enforcement agency response program in coordination with a mental health agency that includes services to improve or enhance that response. Pay salaries as well as expenses such as training, such as overtime and coordination activities to design and implement a police mental health collaboration program to engage citizens through officer outreach and education to improve public safety, to build positive community relations and trust through public communication strategies, and to enhance officer knowledge and skills in responding to community members with mental health disorders or co-occurring mental health and substance use disorders. Other objectives include increased public safety agency capacity to develop and sustain the program by collecting data to inform practices, create stakeholder groups, develop policy, and encourage ongoing professional development. Also, to seek guidance when incorporate and build upon successful strategies for police mental health collaborations. Next, we'll talk about the framework. So this is about the police mental health collaboration framework, and there's a document there. There's a link at the bottom of this slide to visit the document. But these 6 questions are a part of the police mental health collaboration self-assessment tool. And the self-assessment tool helps law enforcement agencies and their behavioral health partners to assess their progress towards implementing high-quality, partnership-based interventions. It's designed to provide resources to help improve responses to calls for service for people with mental health and co-occurring substance use conditions. These questions are used to assess the status of current response efforts, and responses will generate a unique action plan that directs responses to help strengthen initiatives. We encourage you to learn more about the PMHC at the link made here at the bottom of the slide. Next slide, please. For applicants who are awarded the Connect and Protect award, there are a few deliverables that all awardees must complete. First, there's a 2-phase process consisted of first planning and second implementation. For phase 1, the planning phase, the grant recipients will receive intense training and technical assistance from BJA's technical assistance partner. Under this phase, grantees follow a document called the Planning and Implementation Guide. This document is refined each year to meet the needs of grantees. As outlined in the solicitation, for up to 12 months after receiving final approval on the project's budget from OJP, grantees can spend up to $100,000 during this planning phase to work on the training and technical assistance provided through the CSG Justice Center while working through their planning and implementation guide. Past grantees have found that the planning phase really helps to prioritize where to begin the implementation. The second phase is the implementation phase, which grantees begin after BJA approves the grantee's P&I guide, as well as complete all the special conditions on receiving their award. The grantees can then spend the remaining grant funds on directly related implementation activities. So next we'll talk about the deliverables. Okay, so next to continue with these deliverables, document the approach to implementing or enhancing law enforcement behavioral health responses for individuals with mental health disorders or co-occurring mental health and substance use disorders who come in contact with the criminal justice system. Next, to collect data on program use, effectiveness, and outcomes and analyze across different demographics. Conduct an evaluation of the PMHC. If the grantee decides that's something that they want to do, they can receive assistance with that. And community satisfaction. Working with a researcher to collect program data is an allowable expense. We'll continue with additional deliverables. So grantees can also engage in regular training and technical assistance activities with the BJA Training and Technical Assistance Partner to include completion of the Planning and Implementation Guide, as I mentioned earlier, and also to outline a plan for obtaining necessary support to continue the proposed collaboration beyond the federal support. So next, we're going to talk about program-specific priority areas. All right. The Office of Justice Programs, of which the Bureau of Justice Assistance is a part, weighs many factors when making funding decisions. This includes, but it's not limited to, giving priority consideration to applications that meet the following criteria. Supporting Executive Order, it's a citation there, 13985, advancing racial equity and support for underserved communities through the federal government. And this is a new piece in this year's solicitation, really important to this administration. To receive consideration, the applicant must describe how the proposed projects will address potential inequities and barriers to equal opportunity and/or contribute to greater access to services for underserved and historically marginalized populations. Also, to promote effective strategies for law enforcement to identify and reduce the risk of harm to individuals with mental health disorders or co-occurring mental health and substance use who encounter law enforcement and improve public safety. Other program priority areas include promoting effective strategies for the identification and treatment of females who have been incarcerated with mental health and substance use disorders. Also, to propose interventions that have been shown by empirical evidence to reduce recidivism. When appropriate, use validated assessment tools to target people incarcerated with a moderate or high risk of recidivism and a need for treatment services. To receive priority consideration under any of these areas, applicants must identify in the proposal abstract each area for which the priority consideration is being sought, and they must describe in the proposal narrative how they will address each priority. Please note, addressing these priority areas is one of many factors that OJP considers in making funding decisions. Receiving priority consideration for one or more priority areas is not always a guarantee of an award. Next, we'll talk about application requirements. Again, I just want to reemphasize that applications must include detailed activities for both a planning and an implementation phase. They must also include at least one criminal justice agency and one mental health agency that will work on the program together collaboratively, with roles and responsibilities being outlined and described in a submitted and attached memorandum of understanding. Next, we'll talk about awards, amounts, and durations. There is an anticipated total of 27 awards that we hope to make through BJA, with each awardee receiving approximately $550,000 for a 36-month, three-year project, which is expected to begin on the federal fiscal year of October 1, 2022. So next, I'd like to hand the presentation over to my colleague, Tammy, and she is going to talk a little bit more about the budget. Tammy?
Thank you, Maria. I wanted to go over a little bit more about the budget, as Maria had stated. The budget should be clear, should be complete, cost-effective, and allowable. All costs should be reasonable, allocable, and necessary for project activities. Again, as Maria stated earlier, only $100,000 of the funds will be available to complete the planning phase within the first 12 months of the project. The budget should clearly indicate the cost for the planning phase. Additionally, there are several costs that are not allowable within the Jmhcp funding. It does not fund construction. Additionally, prizes, rewards, entertainment, trinkets, and any other monetary incentives, such as client stipends, gift cards, vehicle purchases, and food and beverages, are still all unallowable costs. Jmhcp funding. Authorizing legislation requires a non-federal match of 20% total project costs within the project years 1 and 2, and then a 40% match in the year 3. Cash and/or in kind, such as third-party match, is allowable. Match costs in the budget must meet the same guidelines as federal costs for being allowable, reasonable, allocable, and necessary for the project. It is recommended that you do not include an excessive match over the minimum requirements in the application budget. For clarification on the differences between a subaward versus procurement contracts, please carefully review the OJP Grant Application Resource Guide, which is linked in the solicitation subsection titled Information on Proposed Subawards, if you have any that are planned, and proposed procurement contracts, again, if you have any planned. And the resources linked there within to ensure that you properly categorize your cost in these sections. There are different administrative requirements related to each. For example, a procurement contract requires full and open competition, while a subaward does not. On this note, I want to thank you for joining, and I'm going to turn it back over to Demetrius.
Tammy, I think that you were going to continue until, if not, I can, but I think that you were going to continue until I believe the next agenda slide.
Oh, okay.
But if not,
No.
Does that work for you? If not, I can do it.
That's fine. That's
Okay.
fine. We're going to go over briefly what an application should include. It should include the SF-424 Federal Assistant Form, which is actually completed in grants.gov, an abstract, a project abstract, which is attached in Just Grants, the program narrative, which is also attached in Just Grants, goals, objectives, deliverables, and a timeline, which is web-based in Just Grants now. A budget and associated documentation, additionally web-based in Just Grants, an indirect cost agreement, if applicable, the financial management and system of internal controls questionnaire, including applicant disclosure of high-risk status, which can be downloaded and attached in Just Grants. Disclosure of processes related to executive compensation, attached in Just Grants, once again, if applicable. The memorandum of understanding, which can be attached through Just Grants, and then a tribal authorizing resolution, if applicable. Additionally, research and evaluation independence and integrity statement, if applicable. Documentation of advancing DOJ priorities, if applicable. Documentation of high poverty areas or persistent poverty counties, if applicable. Disclosure of lobbying activities, which is actually completed in grants.gov. The DOJ certified standard assurances, which is completed in Just Grants. Applicant disclosure of duplication in cost items, which is completed in Just Grants. The DOJ certification regarding lobbying, debarment, suspension, and other responsibility matters and drug-free workplace requirements. And finally, applicant disclosure and justification for DOJ high-risk grantees, which is also completed in Just Grants.
Thanks, Tammy. And I just want to also flag that as well as the information listed here, please note that applicants are not required to submit performance data with the application. Rather, performance measures information is included as an alert that successful applicants will be required to submit performance data as part of the reporting requirements under the award. Also, an applicant that proposed to use award funds to conduct project evaluation must follow guidance under the note on project evaluations under the OJP Grant Application Resource Guide. Applications that meet the basic minimum requirements will be reviewed by peer reviewers. Applications will be evaluated on how the proposed project program addresses the following criteria, and each criteria is weighed as 15% for the statement of the problem, description of the issue, 40% for the project design and implementation, 30% for the capabilities and capacities, 5% for the data collection and performance measures plan, and finally, 10% for the budget. I will now briefly highlight the submission requirements. Applications must be submitted to DOJ in a two-step process. Step 1 is applicants must submit an SF 424 and an SF LLL in grants.gov by 8:59 p.m. Eastern Standard Time on May 27th at the reference link. Please note, to register in grants.gov, applicants will need to obtain a Data Universal Numbering System, DUNS, and a System for Award Management, SAM, registration or renewal. Step 2, applicants must submit the full application, including attachments in Just Grants, by 8:59 p.m. Eastern Standard Time on June 1st at the reference link. All applicants are encouraged to review the How to Apply section in the OJP Grant Application Resource Guide. OJP urges applicants to submit applications at least 72 hours prior to the application due date to allow for the application to receive validation messages or rejection notifications from grants.gov and to correct in a timely fashion any problems they may have caused a rejection notification. Tips to prevent issues include, the next 3 slides highlights these tips to help prevent these issues. 1, remember there is a 2-step process, submission process. Be clear on the deadline for each process and reference the How to Apply section of the OJP Grant Application Resource Guide as previously mentioned. 2, make sure that the correct DUNS number is entered in the SF 424 and that it is registered in SAM. The specific agency registered under the DUNS number in SAMs will be responsible for submitting the full application in Just Grants and administering the award if it is funded. 3, the federal request amount entered in the SF 424 should match the total federal request in your application budget for the entire grant period. 4, do not include any of the prohibited costs listed on page 7 and 8 of this solicitation. 5, although the MOU between the Criminal Justice Agency and Mental Health Agency attach the MOU between the Criminal Justice Agency and Mental Health Agency partnering on the award. 6, all applicants must complete the disclosure of duplication in the cost items in Just Grants. And then finally, 7, if funding is being used to pay an outside evaluator or researcher, then applicants must complete the research evaluation independence and integrity attachment. Again, see the OJP Grant Application Resource Guide for further instructions. Now we will begin the question and answer portion of the webinar. Saw that some questions have already come in. We will respond to as many questions as possible in the time remaining. As a reminder, you can ask the question by clicking on the Q&A button at the bottom of the screen and entering your question. Also, as we are taking questions, we will advance the remainder of our slides, which have information about the upcoming Responding to the 2022 Solicitation for Justice and Mental Health Collaboration Program webinar, which is occurring tomorrow, Thursday, May 19th at 12:30 to 2:00 p.m. Eastern Standard Time, as well as the contact information for all of your speakers in case you have additional information or questions. Another reminder that this webinar has been recorded and will be posted along the slide deck on the CSG Justice Center website. I will now turn to any questions that we have in the Q&A box. The first question, I'm going to kick it off to Maria. Maria, this question is this the first time this funding grant has been offered? Is it likely to come out again in 2023? We are planning to apply for the next year of funding.
It actually was first posted in fiscal year 2021. So this is the second year, and we will likely, as long as Jmhcp continues to be authorized and funding appropriated, we will continue to provide this solicitation opportunity.
Thanks, Maria. The next question, I'm going to kick it over to Tammy. Tammy, the question is it allowable to have a shorter planning period? And I believe it's to spend less than $100,000 on the planning phase, which then the remaining amount can be added to the implementation phase.
Thank you, Demetrius. Yes, you can have a shorter planning phase as long as you follow the guidelines that the planning and implementation guide need to, as long as you follow that guideline and it's approved by CSG and BJA. You don't need to take the 6 months or a year to develop it. And then if you spend less than $100,000 on it, that's fine. You can just reallocate it via a budget modification at a later date.
Thanks, Tammy.
You're welcome.
I'm going to find a question and kick it to Maria. Maria, there was a question in the chat. Can you review the organization requirements for profit organizations again? I guess the person just wants you to reiterate the information that was included, I believe, either on slide 10.
Sure, yeah, if we could pull that back up. So this year in the solicitation, I tried as best I could to clarify that, per the legislation, you must be a government entity, a state, tribal, or local government entity in order to be eligible for this program. And there is a requirement for a partnership with a mental health organization. So those are two separate things. If there is a nonprofit that is acting on behalf of the state, so in essence, they are designated as a state agency, not just has a contract to provide services or certified to provide services, just actually designated by the state, and you show up on a list that the state says this organization is acting on our behalf to provide services, because sometimes it's a rule, there are rural parts of the state and nonprofits do provide services on behalf of the state. If that is the situation, then they could be eligible for the funding, to apply for the funding. I'm going to shut my camera off because it's already starting to lock up a little bit. But so I hope that clarifies. The eligibility is state and local and tribal governments.
Thanks, Maria. If there's any follow-up for that question, feel free to drop it into the Q&A panel below, and we'll have a follow-up to that. Tammy, I'm going to kick this question to you, and it was asked 3 different times, and it's regarding the DUNS number and the SAMS number. The question is, is the DUNS number still required, or has things shifted to an UEI number, or is it both? I believe folks have had some issues with submitting a DUNS number, or whether they were required to submit a DUNS number in other application submissions, as well as their understanding that there was a shift to UEI numbers on April 4th. So can you just respond and see whether a DUNS number or UEI number is required for the submission of?
Oh, sure. It should be the UEI, as things have shifted from the DUNS to the unique entity identifier. That's what UEI stands for. I'm going to have to check. I'm not sure if Maria has the answer to this or not. If somebody doesn't have that UEI, which they should, if they already have a DUNS number, they should automatically have converted to a unique entity identifier number, which is what they would use with the application. But if they don't have that, they should be able to use their DUNS number. But I'm going to have to verify that.
Thanks.
So just to add to that, I have just briefly, Tammy, you covered it. I understood that it did switch to UEI in April, but then I've also to understand that SAM's registration is still somehow connected and needs to maintain currency. So I think we probably need to get that information in, maybe put it back out there, or go to the Just Grants site and get more details.
Thanks, Maria and Tammy. So it seems like what we're saying is we'll follow up to let folks know specifically once we do some follow-up, but it sounds like you should be using your UEI number to solicit to apply through Just Grants. However, if you don't have a UEI number, then it's quite possible that you can still use your DUNS number. And we'll follow up for more accuracy. The next question, Tammy, Maria, I'm actually going to kick this question to you. It's a more programmatic question on eligibility. The question is, if a jail is considering contracting for complete medical services for inmates, would the portion of the contract applicable to MHL services and/or mental health medications to inmates with MHD and MHSUD be considered for this grant?
Yes, those are all allowable activities. Certainly co-occurring disorders are in the jail is something that needs to be treated, and MAT is an allowable cost. And I hope that answers the question.
Thanks, Maria. I'm going to kick these next two questions to you, Tammy. They're regarding in-kind matches. The first is, what is an in-kind match? And is there an in-kind match for this grant, and how much is that amount?
Yes, so there are two types of match. One is a cash match and one is an in-kind match. Specifically, an in-kind match, an example of that, the best example I can give really is if you have a project director or a director of a mental health facility that is going to designate a certain percentage of their time to this award, then they would take that amount of time and what their salary is for that amount of time, and that would be considered their in-kind match. Now, there is match affiliated with this award. It is an escalating match for year 1 and year 2. It is 20% of the total project cost of the federal dollars for year 1 and year 2, and then 40% for year 3. So in other words, if your federal costs for year 1 is $100,000, it would be 20% of that. Likewise with the year 2, and then year 3, if your cost for year 3, your federal dollars are $100,000, it would be 40% of that. And then I strongly advise them to use the federal match calculator, which is on the website, and it should also be linked in the federal solicitation.
Thanks, Tammy.
You're welcome.
This next question, I'm going to kick it over to Maria. Maria, I think the question is, can an agency apply to, if an agency is a mental health agency, make 2 separate applications with 2 different law enforcement agencies in 2 different counties? So I guess the question is, can the same mental health agency have multiple applications?
Yes, actually they can, because I could see where a mental health authority or a state agency, you know, first of all, they have to meet eligibility in terms of being a state, federal, or government entity. So that mental health authority would have to be a designated state agency working on behalf of the state or local government. And then once that's satisfied, I could see that entity being sort of regional and maybe have a coverage, like a service area that is inclusive of several law enforcement agencies. And they would maybe be the partner for several law enforcement agencies. So I can totally see that. And as long as they're not submitting the same application, I think that's probably what I would be looking at, like I think the activities for those law enforcement agencies, I would think would be tailored and customized to those local needs. So I would be looking for that, I think.
Got it. Thanks, Maria. Maria, not to give you 2 questions back to back, but this next question is also fall under your wheelhouse. The question is, are agencies who are already collaborating with the mental health agency encouraged to apply, or is this grant more so designed for agencies who have not started the work? This particular person who was asked this question is from an agency who already has a co-responder program, but is thinking that their program might not be eligible because there's a specific requirement here that grantees go through a planning portion. So they just wanted to know if they are eligible for this grant.
Okay, so I would say if you're already doing some planning, then you're probably just ahead of the game. That's what I would encourage you to apply. And I think if you already have a mental health partner, I think that also kind of puts you a few rungs up on the ladder, and because it tells me that you have good relationships with service providers in your community, and there's a requirement to partner with between the criminal justice entity and the mental health entity. So there has to be a collaborative partnership there anyway, and it sounds like you've already got that. What I would say is look to enhance what you already have, and look to training and technical assistance to learn how you can improve and enhance what you've already built. And there's always room to grow and to learn, and it sounds like you've got a good foundation, but I would still encourage you to apply.
Thanks, Maria. We still have about 14 more minutes left. I don't see any questions in the chat or in the Q&A panel. However, feel free to drop more questions in the chat and ask any follow-up questions if something isn't clear. I'll just allow a few more minutes or a few more seconds or minutes for any additional questions before we move on to the final slide and wrap up. Yes, we will email me, Amy, we will put I can email it. Yes, I can definitely email the recording as well as to the participants. I can do that. But also the recording will be on the Justice Center event page website. Hopefully, if not by the end of this week, by the beginning of the middle of next week. The next question is just to, we need another clarifying, maybe Maria, if you can, ground a little more folks on what type of mental health agency is eligible to apply for the grant. I think there's still maybe a little more confusion around that. But the direct question is about who is an eligible mental health agency to apply.
Okay, sure. So I wonder if it might be helpful, Demetrius, for us to put up that link. Remember we talked about SAMHSA has a link for all the state mental health authorities. Who is your state mental health authority? Who runs all the behavioral health services across the state? I think that's really important to know, number one. And then also number two is who works on behalf of the state. So knowing who the state mental health authority is, and then understanding who provides services, not just who's credentialed, but who's contracted to provide services, but who is actually working on behalf of the state. That's what satisfies the legislative requirement that applications must come from a state, tribal, or local government. So that's what makes a mental health agency eligible to apply. So that's separate and apart from the requirement of collaboration between a law enforcement agency and a mental health agency. If a law enforcement agency has a partner already, but they're just, a nonprofit that provides really good best practice services, but they're not a state agency and they're not acting on behalf of the state, that's okay because they've satisfied their requirement, and the law enforcement agency is the government agency that's applying. So So that has been satisfied. The partnership has to be satisfied, and then the applicant has to be eligible. And so those are the two things that have to be satisfied. And in order for an applicant to be eligible, they have to come from a state, local, or tribal government entity. So I hope that clarifies. It's very confusing. I worked on this for many years trying to clarify. Every year I feel awful because I get really great applications from behavioral health organizations that are just not eligible because they are not recognized by the state mental health authority as acting on behalf of the state. So hope that helps.
And just probably as a real life example, Maria, this follow-up question can maybe provide some concrete examples of the type of agency and program who are eligible to apply. The question is, what are examples of mental health agencies? Will a co-responder program that is funded and underneath a sheriff's office be considered to meet both the law enforcement and mental health agency partnership requirement?
Yes. So that meets the requirement of partnership and collaboration between the law enforcement agency or the criminal justice entity, really is what the legislation says. So the criminal justice entity and the mental health authority. So that satisfies that piece. The application should come from the sheriff's office because that's the government entity. Unless, a lot of times, and I've seen examples of this, where it's a very small agency and they may not have capacity to manage a federal award. So, oftentimes the partner, the mental health partner will offer to apply. And I think that's great. That's a great collaboration, but that mental health partner must be a designee of the state in order to be eligible to apply. So hope that helps with a real life example.
I think so. Thank you, Maria. Tammy, I'm going to kick this question to you. If applicants have questions to ask while completing the application, whom should they reach out to?
Oh, thank you, Demetrius. They can contact me.
Oh, that's very generous of you. I was going to say that throughout the solicitation in the webinar, we've offered some links if you have any questions or follow up to complete the application, including the OJP resource guide, as well as the other links throughout the documentation. So I will say, before folks bombard Tammy, who's kindly offered to take on the questions, I would say try reaching out to those entities. And then if you don't get support there or still can't understand something, then you can feel free to reach out to Tammy, whose contact email is listed on this current slide. Next
that is
question.
very generous.
Yes, that is very generous.
We are a very small shop, and that's why Demetrius and I are we are very grateful to Tammy, but there are a lot more of you than there are of us. That's why we
Absolutely.
say that.
The next question, Maria, I'm going to kick it off to you. What is the difference between today's Connect and Protect webinar versus tomorrow Justice and Mental Health Collaboration Program solicitation webinar?
Sure. So this program, the Connect and Protect Law Enforcement Behavioral Health Response, is part of Jmhcp. They have the same funding authorization and legislation, but this program was created separate and apart from Jmhcp so that we could address more resources at the front end of the criminal justice system, specifically for first responders and for law enforcement, so that we can prevent people from entering the justice system in the first place. Because as you know, once folks start progressing through the criminal justice system, they stay longer, much more difficult upon reentry and all the things that come with it that you know even better than I do. So this program came from Justice and Mental Health Collaboration, and that's why it's very similar, but it addresses intercept 0 through 1 and maybe 2. But Jmhcp is now, it is the same JMHCP that you've always known and loved, but it's focusing now on those individuals who are now in the criminal justice system and moving through the criminal justice system, because either they weren't appropriate for a diversion, maybe, you know, whatever the offense was, they couldn't be diverted, or they weren't identified. A lot of people with mental health disorders are not identified. And so for all various reasons, the folks that are in jails and in courts, and we need mental health courts, we still do, or problem-solving courts that address mental health concerns. And then, of course, the case management so necessary for reentry, and also all the assistance with building crisis capacity in the community and the partnership and reentry, of course. JMHCP covers that as well. So JMHCP, think of that as jails all the way on through the continuum, through reentry, as well as services in the community.
Thanks, Maria. Also, additional information on if you need help with or requirements regarding the solicitation, you can also contact the response center. I'll drop this information into the chat just so that you all will have it. There you are. Just to follow up on if you have any additional, before reaching out to Tammy, if you have any additional questions on this is solicitation or completing the solicitation. All right, we have about 4 minutes left, and we can wrap it up. As I'm going over the next slide, if any questions come in, we can answer them. But of course, finally, I want to thank everyone for attending. And if you haven't done so already, we would really encourage you to join the CSU Justice Center newsletter listserv. Not only is this a great way to learn about funding opportunities such as the JMHCP grant, but you will also receive information on upcoming trainings and resources from our agency and our partners. And I also wanted just to reiterate that the recording along with the slide of this webinar will be placed on the Justice Center events page by, if not the end of this week, the beginning of next week. You should feel free to access that if you need any further information. With that being said, I will give you all 3 minutes back to your lives. Thanks everyone for participating in the webinar. And if you are interested and think that your agency is or entities are interested or suitable for the Justice and Mental Health Collaboration Program solicitation, feel free to join that webinar tomorrow, Thursday, May 19th, Eastern Standard Time, being from 12:30 to 2 p.m. Thanks everyone for joining. Have a great day.